Now, for more on all this, I spoke to Professor Catherine Jacobson from George Mason University, and I asked her what resources were lacking to tackle this epidemic.
The first one is health education. So there's a lot of miscommunication on the ground in West Africa about how the virus is spread, what the symptoms are, and how it's prevented. So health education is a big need. Second big need is medical equipment. So to prevent the spread of the virus, we need gloves and water impermeable gowns, face masks that cover the eyes. A lot of hospitals and clinics don't have those.
One thing that's been brought up is a number of doctors from all over the world have been going to West Africa, and they had quite a bit of protection as well. But 60 of them, or more got sick, and many have passed away. How did they contract the disease if they're so well protected?
Well, most of the healthcare workers who have died are local healthcare workers who may have been treating patients before they had access to all the necessary equipment. So that is one of the factors. But the third main thing that we need to work on is transportation. So a lot of supplies are coming into the country, but that doesn't necessarily mean they're getting to everybody who needs them.
When the WHO says that it's out of control, what does that mean besides the obvious, but to regular people like us? Is it time for us to panic, or is it a technical term?
That is not a technical term, and those of us who don't live in West Africa should not be panicking about our own risk. What it does mean is that in West Africa, it's not slowing down, that every day there seem to be more cases.
It's getting worse.
Right, where we would prefer, obviously, to start seeing there being 0 new cases every day. That hasn't happened yet.
So a lot of us have watched enough movies to know what they normally do, right? The army steps in,
That's right.
People get quarantined, and flights in and out of different areas get controlled. And there's going to be an obvious economic impact, although that's secondary to the health reasons. But I want to start with transportation itself, because that seems to be a key driver of how this virus is spreading. Flights in and out, is that likely to be affected in a more severe case as this progresses, if it gets worse, as they say it will?
A lot of people who are falling ill are getting sick in rural areas. And if they want to go to a hospital to be treated for Ebola, they hop on a bus. So that's where most of the transportation issue is right now. A lot of the affected countries are closing down some roads to try to stop the Ebola from going across internal borders. But I do think that as this goes on, fewer people will be trying to travel to those countries, so there will be fewer flights, and that will have an economic impact.
This has been around for 30 some odd years.
Well, we know it's been around since the 1970s. It might have been around for many decades or centuries before that.
So my question, you may know where I'm going with this, why isn't there a vaccine or a cure? Why is there not something that is perhaps further along than what we have now, which essentially is serums and tests?
Yeah, so prior to this outbreak, only a few hundred people worldwide had ever been known to have Ebola. And so that means that it wasn't really a high public health priority. When we look around the world and we see the numbers of deaths from malaria or from cholera or other diseases that maybe don't kill quite such a high percentage of their victims, but still cause a lot of deaths around the world, that's where we've chosen to put our public health research dollars. I think that's changed now that we've seen that Ebola isn't limited to Central Africa and that it can cross borders. Now this will be at the top of our list of priorities.
The World Health Organization is asking for $100 million, and there are a number of public and private partnerships and NGOs, for example, the Gates Foundation, that give plenty to Africa.
Right.
Does more need to be done? I mean, is that enough? First of all, $100 million, it doesn't seem like it's enough given the scale of what we're watching on the media. It seems you need billions, not millions.
Yeah, $100 million is actually not that much, and we're going to have to see where we want to allocate those resources, whether that's doing the urgent on-the-ground stuff right now, or whether more of that is diverted into long-term solutions, like looking at vaccines and treatments.
If we're looking for good news out of this, what do we want to see or hear from the medical professionals there on the ground, whether it's the CDC or the WHO? What do you want to hear to get a sense that things are under control?
Well, the first thing we want to look for is to start seeing the number of new cases every day or every week come down. In the long run, what we hope is that this is a wake-up call that says we need to be working on strengthening health systems, that we need to make sure that we have enough doctors and nurses in places like West Africa, that we have a supply chain that makes sure that they've got the gloves and the gowns and protective gear that they need, and that international communication is strengthened so that as soon as there are cases of something like Ebola, it's reported internationally, and the international community responds right away.
The African Summit is happening here in Washington, D.C., and I'm sure this is a very important topic that's being discussed now. What would you like to hear from government officials in terms of how they're preparing themselves or preventative care and how they can avoid the kind of contagion, if you will, that we've seen at least in the past couple of months here?
So Africa is a large and a very diverse continent. There are going to be about 50 countries represented at the summit, and only 4 of them have Ebola cases at the moment. So I'm not sure that Ebola is going to be at the top of the list. I know nutrition and security are really high priorities right now. I think part of what we can see from this is that delegations of people from Africa can fly here to Washington, D.C. and meet and be safe, and that we don't have any Ebola showing up here. I don't expect that there will be any health problems with the delegates, but having this meeting will be proof that we're able to come together even during this time of crisis in West Africa.